Hello students, today we shall learn about the topic anemia. I hope this term is pretty familiar to all of you, which means like you would have heard people asking, are you anemic? Why is your eyes white? Or why are your hands looking white? So all this means that there is some kind of a low blood count. So when you say anemia, it is related to the number of red blood cells, and anemic means what? There is less amount of red blood. So anemia, when you say what is the meaning of anemia, it is a condition in which you lack enough healthy red blood cells. And what is the main function of the red blood cells? It is to carry adequate oxygen to your body's tissues. Okay, so there is a main function, and I hope you remember this learning about blood and its components in your anatomy classes. Okay? So having an anemia makes you feel very tired and weak. So whenever a person is anemic, okay, so they're going to be looking very pale, they're going to be feeling very tired and very weak and fatigued. Okay, and also there are different types of anemia, because you know in blood there are different components like RBC, WBC, platelets, and all that. So and all this, the main production house is your bone marrow. So any kind of discrepancy or any kind of disorders with this kind of functioning or formation of these red blood cells or this blood components will lead to such kind of disorders, right? Now anemia can be temporary or long term, and also it can range from mild to severe. Okay, but again we should remember that when we start seeing these signs and symptoms, when a person is feeling extremely tired, even after even without doing any kind of physical activity, even if you're having difficulty in breathing, always feeling like lying down or sleepy and not interested in any sort of activities, and all this is going to become a problem. And this sort of anemia, it can be a warning sign to many serious illnesses. So that is anemia. So I hope you have understood the meaning of anemia. So it is nothing but a lack of healthy red blood cells, and which is the main function of which is to carry adequate oxygen to your body. Now this is exactly what I told you. When you're looking at an anemic person, now a normal healthy individual will look pink. Okay, so when you look at the red blood count, you will see that there is enough RBCs in your blood, and when you look at an anemic person, you can see that there is insufficient or lack of the red blood cells, and that is a condition called. Now, as I told you, there are different types of anemia, which is called as iron deficiency anemia. Means again there is excessive loss of iron, okay, in the blood, and again women can be a risk to this, because because of the women's excessive menstrual bleeding or any kind of injury or bleeding disorders that is happening, and that is what gives you a lack of iron in your system. There's something else called as the megaloblastic anemia. So this is related to your vitamin B12 and folic acid. And again, what happens is again related to your bone marrow, because it may be producing abnormal RBCs, that's nothing but abnormal red blood cells. There is something else called as a pernicious anemia. So what happens here is the stomach. Okay, so this is the inability of your stomach to absorb the vitamin B12. Okay, in the small intestine. So what happens here when something like this happens? Yes, the person can end up with a condition called as anemia. Again, the types will also include hemorrhagic anemia, which is nothing but excessive loss of RBCs. Hemolytic anemia, what happens? Hemolytic. So again, it means lysis, or lytic means there is some kind of a rupture or a break. So when there is a break or a rupture of the red blood cells plasma membrane, it can lead to this sort of anemia called as hemolytic anemia. There's also something called as thalassemia. So nothing but again there is less production of this hemoglobin, and again it is not it is as per statistics, it is found in people in the Mediterranean Sea, and that is the research. So that is thalassemia is also one sort of anemia. Something else called as sickle cell anemia, so which is nothing but a hereditary blood disorder, where it is characterized by the red blood cells assume an abnormal shape and size. So it is nothing but it becomes like a sickle shape. So I will show you that in detail. So it's like a crescent, like the moon. Okay, the crescent moon, or like the C-shaped thing. So there is some kind of abnormal morphology of these red blood cells, and as a result of which they will be functioning abnormally. There is also something called as aplastic anemia. What happens here is there is a destruction of the red bone marrow, and again this is what it causes the lack of formation of these blood cells, and this sort of anemia is called as the anemia. Now, there is some classification of anemia. So, anemia can be classified based on the types. As I mentioned, it can be hereditary, or it can be due to some kind of the bone marrow disorder, or the bone marrow is not producing or synthesizing adequate amount of cells. Maybe whatever they're producing also is of abnormal morphology, the shape, size, nothing was right. So that can also be one of the reasons. So the classification of anemia can be done based on the cause and also on the basis of the morphology. When you say morphology, something that like the structure of your RBC. Now, based on the cause means what? Why do we have this lack of blood cells? So it could be related to any sort of blood loss or injury or some kind of bleeding, and it could also be related to inadequate production of these normal blood cells. So again, it is related to your bone marrow functioning, and it can also be related to excessive destruction of these cells. Okay, so it will be inadequate production and also due to excessive destruction. So whatever red blood cells are being produced, for some reason they may be destroyed as well. And based on morphology, based on their structure and shape and size, it can be classified as normocytic, macrocytic, and also microcytic. So again, we learn about all detail. Now, what are the causes of anemia? So again, this is again, you can write whatever I have classified, both in the classification. The same thing you can write it as maybe due to bleeding, it can be due to decreased production, it can be due to excessive destruction, and also it may be due to because the production of red blood cells because of the poor kidney function as well. So that can also be one of the causes. So this can be called as anemia. You can put it in a diagrammatic form like this. When you're saying causes of anemia, it could be related to metabolic disorders or conditions. It can be related to any kind of disorders of the spleen as well, and excessive bleeding. So when you say excessive bleeding, it can be any sort of injury causing problems, or and in women, when you see if you don't see any sort of injury on the exterior or any sort of bleeding on the internal, it could be the menstrual problem. So again, because of external bleeding there, the women can be losing a lot of blood. There is also something called as iron deficiency. As we mentioned to you that it is nothing but lack of or loss of iron. Okay, so that can also be one of the reasons. And cancer causing anemia, again, if the person has got a disorder or disease, cancer, and which is something sort of a malignancy, this can also result in a condition called as anemia. And genetic factors means it is already related to hereditary and genetic disorders, again, could be related to this condition. Now, what happens during this or due to this particular condition? There'll be the main thing is shortage of iron. Okay, so the main component over here is less iron in the body, and what happens here is the bone marrow needs iron. Why does it need iron? Because that is when it can make the hemoglobin. So that is the most important component. And without this iron, again, the body cannot produce the adequate amount of hemoglobin for red blood cells, and decreased hemoglobin may result in insufficient oxygen delivery. So I don't have to explain to you all this, because by now you should be knowing about what are the main components of the blood and what is hemoglobin, what are the main functions of a hemoglobin. If any doubts, please go back and have a read, and only then you will be able to really understand the pathophysiology about what is actually going on in your system. So basically, lack of iron, again, there is no hemoglobin, and if there is no hemoglobin, you know that it does not carry, there is no way that the body can have, or the body's tissues can receive this adequate amount of oxygen, and that is the reason why the person will be feeling anemic. Means that is the reason of these symptoms of having this excessive fatigue and tiredness, and also difficulty in breathing. Okay, so that is the pathophysiology condition. Now, the signs and symptoms of anemia, again, overall, I think there will be a pale look, means a very whitish look. Again, there's nothing but you can see that it can affect the entire system. It's not just about your blood. Again, when the blood, if it is affected, then you know that it can go to your entire system. So yes, it can be affecting your brain, the central nervous system, again, causing, the symptoms will be including dizziness and fainting, and again, fatigue. And you will not be able to think correctly. Your brains will be like fogged, and there's fainting as well, and also there'll be a yellowing of the eyes. The skin can look really pale. It can be cold and clammy. The blood vessels, again, there'll be low blood pressure. Respiratory, again, the symptoms will be like shortness of breath. Muscular, again, there's going to be severe weakness. Intestinal, again, there'll be changes in the stool color. Heart, again, it can affect in such a way that yes, there'll be rapid heart rate, palpitations, chest pain, angina, heart attack. Spleen, again, there's going to be enlargement of the spleen as well. So again, these are the different ways, even though we say that it's just one component in the blood, but again, that is how it can affect your system. What are the risk factors of anemia? Basically, a diet which lacks in vitamins, intestinal disorders, menstrual problems, pregnancy, chronic conditions, and as I mentioned to you, any other kind of diseases or malignancies can also result in this particular condition. Family history, because it is definitely hereditary and genetic oriented. And other factors mean when you say that other ailments or disorders in the body related to kidney functioning, and age is also one of the most important factors. And even in this, again, yes, stress as well as obesity will also play an important role, as always. And these are the main importers of anemia. The complications, again, what happens due to this particular condition? Yes, the growth and development will be delayed, especially in a child. When you say that in that particular phase you need all the the elements in appropriate numbers and appropriate parameters, and if that is not happening, then yes, there is going to be definitely disruption in this growth and development. Means the child's growth and development is not going to be happening in normal levels or normal stages. The milestones may not be achieved. Again, the bones, the are also going to be affected. Infections are going to be more common because again the body is not able to fight it out, and also there's going to be the respiratory disorders or the complications as well, resulting in shortness of breath, and again chest pain, and yes, even this condition can go critical and eventually death as well. It can affect cardiac, so having cardiac problems. Neurologically also gets affected, and also the liver can also get affected. Individual going in for a surgery with such low counts, it's not going to happen, because again all this has to be ruled out correctly, because that is the reason why we say even during when a patient is prepared for or getting ready for a surgical operation, all these parameters has to be checked, and that is the reason why we say that ensure your blood test and reports are readily available, because we need to ensure that the patient is not anemic, and the blood range or the normal values are always there, because we do not want, especially in surgery, that there's going to be loss of volume, loss of blood. Again, as even if the levels are low already, and in spite of that, if the patient is going to have the surgery done, then yes, it's going to put him in a great complications. So we need to rule out all these conditions, and that is the reason why we say when a patient is going to surgery, always make sure that yes, there is a even the blood bank is informed, so that the required blood group is also available in case if it is absolutely necessary. Now, how do we diagnose this particular condition? Yes, thorough physical examination and history collection is very important as usual, and apart from that, you need to do the complete blood test. Okay, the complete blood count, or also called as CBC. Again, very important, because this is used to count the number of blood cells in the sample. Okay, so especially with anemia, it's very important. You need to know your hematocrit levels and also the hemoglobin in your blood. Now, again, it also tells you, at least for basically, if you do not know the entire blood component values, at least the basic hemoglobin values, and what are the RBC count, WBC count, platelets, all these, the main highlights has to be, you should remember the values of all these. Okay, so normally in adult human being, the hemoglobin values are generally anywhere between 14 to 18 grams per deciliter for men, and for women it can be anywhere between 12 to 16. So anything below that levels is not considered as normal, so we need to ensure that the person gets this normal levels, and only then we will send the patient to be getting a surgery done as well. So for that, maybe the person may be given iron supplements or iron infusions, and IV infusions can also be given, especially when you want to speed up the levels, and especially when the patient is awaiting surgery. So that is the reason why we ensure that all these levels are made to come to the normal range, and only then done. Also, we need to ensure the morphology, because as we know, the anemia can be related to the morphology of the cells as well. So that means how they are being developed. So even when the development phase is not happening properly, when the morphology changes, maybe there is different shape and sizes. So that is the reason why we look at that. When you look at the size and structure, each cell or each component has got its particular shape and size. So any abnormality in the morphology also can change its function. So these are the normal CBC values, just as I mentioned to you. Just make sure you go through them. So you really need to know the basics like the RBC, what it is supposed to be, WBC, hematocrit values, hemoglobin values, and not necessary for all this, because you do not want the the morphological components like the corpuscular volume and all this is in detail. But no, I wouldn't want you to remember these, but at least the basic important things like hemoglobin, RBC, WBC, platelets. So all this has to be kind of. And what I was been telling you about the hematocrit. So the hematocrit is also known by several other names. That is nothing but the volume percentage of the red blood cells in blood. So that is what is called as a hematocrit value. So it is normally, when you look at it, it's given like in the percentage form, and this measurement depends on the number and size of the red blood cells. So when you look at the it's normally anywhere between 40 to 50% for men, and somewhere between 36 to 44% in women. So that is the normal hematocrit value. So it's basically the volume percentage of the red blood cells in your blood. And hemoglobin, as you know, it in males and females. So this is the normal range and expected levels. Now, how do we treat when you know that a patient is or a person is anemic, and after doing all these tests? And as I told you, it can be anything from a mild to a severe condition. So if it is mild, yes, it can be taken care of by your diet. Anyway, helping the patient pump his levels by having a supplement. So it can be having iron supplements, folic acid, B12, and especially when if the person is having any kind of infection, treat them in the beginning stages and make sure it does not progress and cause extra problems like infection and inflammation. And also in worst case scenarios, as I told you, sometimes it can progress and become very complicated conditions as well. So mild can go into severe. So when it goes severe, then that is when you would go in for the detailed diagnosis and investigations, and then you would find out what exactly is the problem. So it could be related to some kind of production problems, and sometimes it can so happen that yes, whatever has been produced is getting destroyed as well. So that is also a problem which can result in this particular condition. And the worst case scenario would be, yes, the person will be having blood transfusion, yes, and again, as mentioned, in hospital scenarios, and especially when a patient is undergoing surgery, it's very important that we check they have the the grouping and cross matching done, and ensuring that the blood is easily available, because you never know what goes on during a surgery. The patient can lose his volume and blood, and that much has to be restored. So blood transfusion, yes, worst case scenario is the person will have to have it. And very important about for that is the nurse's responsibility in making sure the grouping, cross matching, and you do not want to mix. So ensuring all that is thoroughly checked and thoroughly ordered and kept available when the patient undergoes surgery. And last resort would be the bone marrow transplant. So even with all this, if the person is not recovering, and yes, means there is a serious illness or disease, and the only resort for that would be having a bone marrow. Now, generally, how do we prevent this condition? Yes, eat right, and when you say eat right, yes, enhance your system, having a lot of vitamin C foods, because again, absorption is also very, very important. So whatever you eat, the absorption is important, and only then the body actually functions as it is supposed to be functioning. And also eating a lot of iron-rich foods, which is like all your greens and your pulses, your beans, beets, your red meat, fish, eggs, protein, and again, whatever you do, have them in a balanced form. So that is why we always insist of having a balanced diet, and ensuring that you're eating them in appropriate portion, and avoiding the caffeine. So basically tea and coffee, they would say yes, in such conditions, yes, better to avoid any, even if you drink them moderately. Okay? Kind of education you would give, and we have finished the small topic anemia. I shall see you in my next session. Thank you for your time.